Today, we are going to look at a BodyViz brain builder about Neurogenic Thoracic Outlet Syndrome. A broad definition of Neurogenic Thoracic Outlet Syndrome is the pinching of nerves that carry signals from movement and sensory to the arm. A more in-depth anatomical explanation involves compression of the brachial plexus and the superior thoracic outlet. The brachial plexus is where most of the nerves of the pectoral girdle and upper limb originate. These nerves of the brachial plexus carry movement and sensory signals from the spinal cord to the arms and hands, allowing your brain to communicate with your hands. There are 15 nerves of the brachial plexus that arise from one or more of these trunks or cords arising out of C5 to T1 vertebrae. The superior thoracic outlet is a kidney-shaped passing from the neck or upper limb into the thoracic cavity. The STO sits directly behind your collarbone, and you might actually be able to feel it by placing your hand just above your collarbone, underneath your shoulder line where your neck meets your shoulder. You might be able to feel a small indentation, which is your superior thoracic outlet. Symptoms patients with neurogenic thoracic outlet syndrome may experience include numbness or tingling in arms or fingers, pain or aches in their neck, shoulder, or hand, a weakening grip, and the muscle in the base of their thumb wasting away. This is also known as Gilead Sumner hand. Some causes of neurogenic thoracic outlet syndrome include anatomical defects present at birth, poor posture, traumatic events that cause internal changes, such as a car accident, repetitive activity wearing on your body's tissue, like swimming or typing on a keyboard, pressure on your joints, such as obesity or carrying an oversized backpack, and finally, pregnancy, which can cause joints to loosen. Some treatments that doctors may recommend to patients are physical therapy, anti-inflammatory muscle relaxing medications, blood clot dissolving medications, and surgery to remove part of the first rib and/or muscle to decrease pressure and repair compressed blood vessels. Finally, let's take a look at a real patient example. You receive your patient's file and take a look. Age, 20, gender, male, chief complaint, neck and shoulder pain. You invite the patient into your office for an examination and ask him about his daily activities. He reports he is on his college swim team, which he has just come from weight training practice. You ask him to try and squeeze a stress ball with each hand. One arm, though, seems stronger than the other. He also reports a tingling sensation in his fingers that goes on and off throughout the day, especially after practice. This is a classic example of neurogenic thoracic outlet syndrome.